Solidarity forever. Solidarity forever. For the union makes us strong. When the union's inspiration through the workers' blood shall run, there can be no power greater anywhere beneath the sun. Yet what force on earth is weaker than the feeble strength of one? But the union makes us strong. Solidarity forever. Solidarity forever. Solidarity forever. For the union makes us strong. It is we who plowed the prairies, built the cities where they trade, dug the mines and built the workshops, endless miles of railroad laid. Now we stand outcast and starving mid the wonders we have made, but the union makes us strong. Solidarity forever. Solidarity forever. Solidarity forever. For the union makes us strong. They have taken untold millions that they never toiled to earn, but without our brain and muscle not a single wheel can turn. We can break their haughty power, gain our freedom when we learn that the union makes us strong. Solidarity forever. Solidarity forever. Solidarity forever. For the union makes us strong. In our hands is placed a power greater than their hoarded gold, greater than the might of atoms, magnified 1,000-fold. We can bring to birth a new world from the ashes of the old, for the union makes us strong. Solidarity forever. Solidarity forever.
Welcome. We can start today's webinar, and without further ado, I'm going to hand over. I request everybody to introduce yourself. And I'm going to hand over to Laura to start with the instructions for today's webinar.
Thank you, Jean-Lee. Please, the first thing I would like to do is I will begin with the language interpretation instructions, and then each language interpreter will read out the instructions in respective language. For English, all participants need to choose a language. At the bottom, find the icon of the globe or under the 3 dots more to choose your channel. In Hindi, please.
सभी प्रतिभागियों को एक भाषा चुनने की आवश्यकता है। स्क्रीन पे सबसे नीचे अपने चैनल को चुनने के लिए ग्लोब के आइकन या 3 डॉट्स यानी मोर या अधिक के आइकन को ढूंढें।
Portuguese, please.
Instruções para escutar a interpretação de idiomas na plataforma Assuntos. Os participantes precisam escolher um idioma na parte inferior, encontre o ícone do globo ou sobe os 3 pontos mais para escolher seu canal.
Todos los participantes deben elegir un idioma. En la parte inferior busque el icono del globo o debajo de los 3 puntos más para elegir su canal. Swahili, please. Priska, please. Swahili.
Washiriki wote wanahitaji kuchagua lugha.
Please.
Washiriki wote.
Okay, we will move on to Thai.
ผู้เข้าร่วมทุกคนต้องเลือกภาษาที่ด้านล่างจะพบไอคอนรูปโลกหรือใต้จุด3จุดเพิ่มเติมเพื่อเลือกช่องของคุณ
Thank you. Now in Nepalese, please.
यो वेबिनारलाई नेपाली भाषामा सुन्नका लागि यदि ल्यापटप प्रयोग गर्दै हुनुहुन्छ भने तलको स्क्रिनको तलपट्टि पृथ्वीको गोलो जस्तो देखिएको संकेतमा बटन थिच्नुहोला र भाषाको अप्सनमा जानुहोला र नेपाली छान्न सक्नुहुन्छ। यदि तपाईं मोबाइल वा अन्य ट्याब्लेटबाट प्रयोग गर्दै हुनुहुन्छ भने स्क्रिनको बायाँपट्टि देखिने तलको मोर बटन थिच्नुहोला। तीनटा डल्ला जस्तो देखिने ठाउँमा गएपछि दोस्रो पटक तपाईंले ल्याङ्ग्वेज इन्टरप्रिटेसन देख्नुहुन्छ जहाँ नेपाली भाषा छनौट गर्न सक्नुहुन्छ र सुन्न सक्नुहुन्छ।
Thank you. In Indonesian, please.
Selamat malam bagi peserta dari Indonesia. Untuk mendengarkan acara ini dalam bahasa Indonesia, silakan melihat di bagian bawah layar Anda, lihat logo bola dunia dengan tulisan interpretation dan pilih menu bahasa. Terima kasih.
I will go back to Swahili. Either Felix or Priska, can you please give the instruction?
Washiriki wote wanahitajika kuchagua lugha. Hapo chini pata ikoni ya globu na nukta 3 zilizoandikwa zaidi ili kuchagua idhaa unaotaka.
Thank you very much. Now,
Thank you, Laura. And we've just given 1 minute for everybody to select your preferred language on the interpretation. All right. So I'd like to invite Edileza to welcome everybody. Edileza is a working committee member from Brazil, Latin America. Edileza, over to you.
Good morning, good night, Welcome to all the affiliates of HomeNet International. Welcome to all the allies, all the home-based workers to commemorate the International Day of Work. We are very happy that all home-based workers can be together in solidarity today. I am proud of representing a region where the effects of the pandemic has affected our home-based workers. We are going through a terrible pandemic, so our discussion today will be focused on the effects of COVID-19, the lives of home-based workers, and the demands that we have now to recover. In today's agenda, we will start listening about the history of this Labor Day and its relevance for home-based workers. Two representatives of home-based workers of each region will speak about the experiences and demands of the associates. Afterwards, we will have an open space to receive further comments from all of you. Our international coordinator will make a summary of our demands, which will be the base, the foundation of a global letter. We will finish with closing remarks and a song about solidarity. You are welcome.
Thank you, Edileza. I'd like to invite Laura Murillo now. Laura?
Dear colleagues, humankind is going through a very serious health crisis. Many people, families, and communities around the world are facing the anguish of the disease and the pain of losing their loved ones. Now we are receiving news regarding the critical situation of our brothers and sisters in India. Now, more than ever, we need to make the most of the teachings of we are one and Ubuntu. I am because everybody is. We would like to ask all of you to keep a minute of silence, to pray, and to have in our thoughts all our brothers and sisters. Thank you.
Laura. I would now like to invite Suntari. Suntari is the coordinator for HomeNet Southeast Asia, but also the working committee member of HomeNet International. Suntari will provide an update on HomeNet International. Over to you, Suntari, and I will share your presentation.
Janvi, may I share my presentation? Because
sure.
Sure. I will use about 2 or 3 minutes to update the the things that happen in HomeNet International after we have the virtual congress in sorry, after we have the congress. Can you see my screen?
Yes, Suntari, we can. Thank you.
Yeah. First slide, I would like to remind all of you again that we here as HomeNet International, we start with 36 home-based worker organizations from 20 countries of 4 regions, and we representing more than 600,000 home-based workers right now. The focus that HomeNet International currently do is to setting our governance structure and process of work among HomeNet International Working Committee, the staff, and also the affiliate organization like your organization as well. And we focus on working on building solidarity and also focus on communication for visibility of home-based worker. Till now, we already have 2 times of HomeNet International Working Group Committee meeting. First on 17th of March and the second on 23 of April. And in the meeting of the HomeNet International Working Committee, we plan about the solidarities. First activity that we plan to do is the webinar. The webinar that we thinking of is on the issue that will benefit our HomeNet International affiliate and our home-based worker leader. Like we plan to do social protection webinar. We plan to do the webinar on access to market for the product of our home-based worker. And also we plan to organize the webinar on social solidarity economy. That is the new concept of economic system that very suit to the livelihood of home-based worker. And second thing, we plan to organize the workshop on capacity building. Like we plan that in the near future, we will have the meeting with our affiliate of HomeNet International. We will do leadership training. We will train about fundraising, how to do the report. And also we have the idea to discuss or run the workshop on gender in the area of work. And we also work on representation and voice, like Janvi as our coordinator. She joined the Global Union meetings for many times. And in June, that ILO we will have the conference. We HomeNet International will have the representative to join that ILC to voice on behalf of home-based workers. And another thing that we do is working on finance process with the funding agency like a SIDA, Open Society Foundation, DFID, and so on. And also we work on communication and visibility. Now we have the website. You can visit and use this website for communicate your activity and communication inside of our HomeNet International in order to show or to promote the activity that you would like to let the world know about. And also we plan to expand the affiliate by reaching out to Eastern Europe. In the future, Eastern Europe will be our 5th region. And we're thinking of some country like Bosnia, Herzegovina, Serbia, and Montenegro. This is the things that I would like to update with all of you, that to show that from February till now, what is the things that our HomeNet International Working Committee do and plan to do. And we will end, I will end with this slide. This slide is show the picture, is the picture of our website. Please visit it and use it to be our communication tool. That is all the things that I would like to update with all of you. And I would like to pass the floor back to Janvi to run another session of our webinar today.
Thanks a lot.
Thank you.
Thanks a lot for providing all the updates in a very crisp fashion. It's just been 2 months, and thanks a lot for providing all the details. We will be sharing these slides with all the affiliates. Also the fact that we have been sending out some of these emails to a group that we've made. It's called In Solidarity Group. It's via email you get all these updates. Do ensure you receive it, otherwise write to us. We will keep sending you a lot of updates. Thank you, Suntri. And now let's dive straight into the webinar. I'd like to invite Betty. Betty is the working committee member from Africa. Betty will provide the objectives of this webinar. Over to you, Betty.
Thank you, Janvi. Thank you all the members, and I welcome you all to this webinar. As earlier introduced, I'm Betty Lunkuse. I'm a home-based worker, African representative on HomeNet International Working Committee. With pleasure, I want to introduce to you our objectives for today's webinar for home-based workers from around the world. They are threefold. Firstly, to celebrate International Workers' Day together as HomeNet International. Secondly, we want to learn from each other about the impact of the pandemic, almost now 1 year from its inception. And also would like to come up with a set of common demands for recovery for us as home-based workers. Thank you so much.
Thanks a lot, Betty. And I don't want to take too much time. I'd like to invite Chris Bonner. A lot of people here already know Chris, have worked with Chris for many years. And Chris used to be, she's the former director of the org team of Vigo. But the new hat that she wears is that she's the working committee member of HomeNet International too, representing Vigo. And she's an expert. So we have invited her as an expert to actually talk about the history and relevance of the Labor Day. So Chris, over to you. I am going to share your presentation, but you can talk to us about it. Can you see the PPT?
Yes, thank you, Janvi. Oh, hello, everybody. I don't know where I get this title, expert, but I'm not an expert, certainly not. Anyway, very happy to be here, thank you. So what I'm going to talk about very briefly is about why International Workers' Day, or May Day, or Workers' Day, or Labor Day, different titles, why it's important for home-based workers. So that's really what I'm going to talk about. Next slide, Janvi. Okay, but before we do that, I thought I'd just show you a very short video on the origins. We've lost the slide. Okay, so we're going to show a very short video on the origins of International Workers' Day. It's a day celebrated by workers in many countries in the world. And they use the day to highlight their struggles and demands, just as we are going to do today. We're going to highlight the struggle, particularly with COVID, and what are our demands. Okay, and the slogan I've got on this slide is "Workers of the World Unite." Okay, so we're going to look at a lot of slogans. So Janvi, shall we show that very short video? It's about the origins in the USA, very short. Thank you, Jambi. We can return to the PowerPoint. It moved very fast. I don't know if everybody was able to get a translation, but the gist of that was that it originates in the USA in the 19th century, and workers were fighting and struggling for better working conditions and an 8-hour day. At that time, there were no laws that restricted the hours of work. So workers were struggling and they got beaten up by the police, and in fact, four of the leaders were executed. If you saw the video, it showed lots of men. I don't know where the women were at that stage. And also it's interesting to see home-based workers are still working many, many hours. We haven't got an 8-hour day given our childcare demands and our domestic work and our paid work. So yes, so the struggle continues. Okay, so what I'm going to do is just quickly answer the question of why it's important for home-based workers, International Workers' Day. I think the first point is that it starts to see home-based workers as workers and recognize home-based workers as workers. Recognition is such a big issue for us because most people don't think of us as workers. So International Workers' Day is a day for all workers. So home-based workers are workers contributing to the economy, families, and society. We see people working there. So the slogan we've got here are, we are workers too, and this is our day too. So in other words, we are workers, we're part of this international movement. Thank you, Janvi. The second reason it's important for us is to gain visibility. Now, again, this is one of our big campaigns that we're hidden. We need to be visible. So by participating as workers, like all other workers, we become visible. We are seen and heard as home-based workers, not only as home-based workers, but as part of the global workers movement. And HomeNet International becomes known as a global representative of home-based workers. It's not well known yet, so we're starting to become known. And the slogan I've got for this slide is out of the shadows. And the picture is of, some of you might recognize yourself there, home-based workers, representing home-based workers at the ILO in 2016. And we're hoping we'll have more. Thank you, Janvi. Next slide. Okay, so very important, and we talked a lot about it already today, is another reason that we participate. Can you please mute, please? Somebody's speaking. Okay, so solidarity. Our song at the beginning was about solidarity. So first thing is solidarity amongst home-based workers themselves. So celebrating together helps build solidarity and unity amongst home-based workers. This is also important in building HomeNet International. And the slogan we have for this slide is, we are one. Next slide. Okay, and then the next area of solidarity is with other informal workers. Joining hands on common demands gives us a stronger voice. And we are joining hands with street vendors, our sisters and brothers, street vendors, waste pickers, and domestic workers. The top picture is a joint campaign that started in May Day last year. And with all those sectors and with WeGo. And 2 billion strong, recovery starts with us was the theme. The second picture below is due to be launched tomorrow campaign on May Day. And the focus with all of us is investments in social and labor protections are needed for economic recovery. In other words, this year we're focusing on the protection needs, social protection. So I'm hoping you're all going to follow this campaign. So the slogan there is more powerful together. Thank you, Janvi. Okay, and then the other area of solidarity is with formal workers. Celebrating together highlights our common demands as workers in formal and informal economies. Okay, and this is the Home-Based Women Workers Federation in Pakistan, demonstrating together with the National Trade Union Federation in Pakistan. And they got their common demands there. Cancel all debt. We demand job security, payment of wages, and social security for all. And this was 2020. And you can see it's in the middle of the pandemic because we've got the social distances, the masks, and everything. So the slogan is unity is strength. Okay, and the last slide. Okay, we need to participate. International workers is important for us to participate, to raise our voice. We need to be heard. So unity and solidarity with all workers on International Workers' Day gives home-based work a stronger and more powerful global voice. And I think we include our allies in that as well. So coming together gives us a stronger voice. And the slogan there is the words of our song, solidarity forever. So these are just some of my thoughts about why it's important. You may have more thoughts, and it's something that perhaps you can discuss in your own organizations. Thank you very much.
Thanks a lot, Chris. I can hear a translation, so yeah, if you could put on mute. I didn't call you an expert for no reason. That was such an excellent presentation. I'm sure all of you would agree that it made it very simple and easy for us to understand in just 5 minutes. So thanks a lot, Chris. And now I think we get into the main event for today. And that is that we hear from our own home-based worker sisters from across all 4 regions. And now I would like to invite home-based workers, 2 from each region, from Latin America, Africa, South Asia, and Southeast Asia, to talk about, what they want to, but specifically focus on 2 things. First is how is COVID-19 affecting the work and lives of home-based workers in your country or organization now, more than 1 year after the starting of the pandemic? And second, what are the demands of home-based workers now for recovery from the effects of COVID-19? First and foremost, I'd like to invite our sister Patricia Konyaman to speak. Patricia is the coordinator of Coordinadora Nacional de Trabajadores and Domicilio Contratado Chile. She's played an instrumental role in building the network in the Latin American region as well as HomeNet International. Patricia, we'd like to welcome you and we'd like to hear from you. So over to you, Patricia.
Good morning, everyone. I think we're having a historic meeting. For the first time, home-based workers are coming together to commemorate International Workers' Day. So to speak about what's happening today in each of our regions is quite brutal. COVID has taken many of our comrades, colleagues, brothers, sisters, family members. And I think this is a worldwide situation. But even so, home-based workers like us, we are capable of rising. We are capable of coming together to make our work visible, I'd like to tell you that in Chile, the military dictatorship prohibited home-based workers, and our struggle is to get it back. Chile is going through very tough times. We have many COVID-infected patients, a government that is solving the issues with our resources that we were putting aside for our senior age. And home-based workers from Chile will have no social security, will have no pension when they retire. And this is what we're living in the entire world. And this is the model that we want to defeat. Today, April 30, we called for a strike. From 6 a.m. this morning until 10 minutes before I connected to this meeting, we were out in the street striking, demanding to be heard because home-based workers that are underpaid were not paid at all. Our only tool, our only resource is to say that we are also people and we have a right to a minimum wage, at least throughout this pandemic. We've never asked anybody for anything. We have always worked. We have always been scraping to get by. So we would like to call all of the home-based workers who are going through very tough situations today. We have many people who have gone to jail because of people who were fighting for their basic labor rights. We were only asking for for an emergency income of 500,000 Chilean pesos. We'd like the upper class to help the lower classes. Among the most powerful in our country is President Pineda, the Chilean president. And today Chile is demanding his resignation. We are in lockdown. We have a curfew. Nobody can be out in the streets after 9 p.m. We have a 2-day permit per week to be able to go to the supermarket or go to a doctor's appointment. And the military army is out on the streets. So I'd like to say to all home-based workers that if we stand united, we will thrive. We will make our demands known. So I'd like to extend a warm regard to all home-based workers. Long live May 1st, International Workers' Day, and home-based workers. Thank you very much.
Indeed, long live home-based workers. Thanks a lot, Patricia, for that very powerful speech. And just also to say that, you've highlighted the fact that the situation is very similar and there are many individual challenges that many countries face. And thank you for giving us hope and what you are doing in Chile. I'm sure this a lot of workers and motivate a lot of workers across the world. Thank you, Sister Patricia. Now I'd like to invite Sister Gloria Solorzano, Secretaria de Organización. Please excuse my Spanish, I'm trying quite hard. Red Nacional de Trabajadores, Autonomous Renata, Peru. Sister Gloria, please share your experience. Sister Gloria, are you there?
Good morning. Good morning, everyone. Good morning, home-based workers. I'm Gloria Celefano from Peru. I'd like to extend a warm regard for this International Workers' Day. We are gathered here today to analyze the situation and how this situation is standing in every country. Here in Peru, since this pandemic began in March 2020, it's been very tough and critical for us. The government has declared an emergency situation. We've been quarantined and in lockdown. We stopped working. We stopped working because of the poor government plan and planning. And our comrades were evicted. Shops started to be closed down. And us home-based workers were completely out of work. We could not work for any companies. We couldn't work. We had to use up our capital. And so nowadays, we don't have jobs. And what's worse, we've had to change our working situation. Being a home-based worker, we've had to change. And we had to be another street vendor or do anything to get by. We've lost many colleagues because they had to leave Peru and go back to their countries or their regions because they couldn't get by here. So truly, we've had many colleagues that were infected, a big number of colleagues in different regions. Les pido disculpas, pero hay alguien con el micrófono abierto.
They didn't have access to healthcare even. That is tough.
We've been capitalizing.
Use up money.
เดี๋ยวสักครู่นะคะตอนนี้เขามีการ
¿Aló? ¿Puede seguir, no?
สอนกัน
Ya. Entonces,
ค่ะ
ahora estamos pasando peores situaciones todavía.
और ये इसी तरह
Con
से
el
गुजर
alza,
रहा है
con
ये
el
क्या है?
alza
मेरी
del
आवाज
dólar,
क्यों आ रही है
nuestros insumos se ha elevado enormemente. No tenemos que vender ni que producir porque no hay capital. Nosotros estamos viviendo situaciones que afectan enormemente a nuestra organización, en nuestro país. En estos momentos, las elecciones que se vienen ha causado cierta zozobra en todo nuestro sector. Por lo que nosotros apelamos al gobierno. ¿No? Apelamos al gobierno que nos dejen trabajar, ¿no? Nosotros no queremos bonos ni canastas porque no nos ha llegado. Los bonos ha llegado al 1% de los trabajadores en la economía informal.
Danny, should we stop maybe?
Las canastas solamente llegó
Perdón,
a
Carmen,
las personas
perdón.
que han sido empadronados, que se encontraban en su casa. Y como
Carmen.
nosotros teníamos que salir a trabajar a la calle, no fuimos empadronados,
companheira.
no se ha recibido. Sí.
Estamos sem tradução.
Por favor, vamos a parar un momento para reasignar a los intérpretes. Renata, te voy a hacer host para que me ayudes, ¿vale?
Sí, perfecto.
Extremely sorry, Sister Gloria and everybody else. I think we lost a translation system. If you give us just another 5 minutes to get that back in place.
Gloria, en 5 minutos van a resolver la interpretación y puedes continuar, ¿no? Esperemos 5 minutos, por favor. Gracias.
Hola, Renata.
This is Ingar, the Indonesian interpreter speaking.
Hello?
For Indonesian interpreters, can you please assign Irma and I to Japanese channel instead, please? Some of the Indonesian participants haven't updated their Zoom, so they could not access interpretation earlier. Apologies for the inconvenience.
Okay, thanks.
Thank you so much. Bagi para peserta bahasa Indonesia, mohon maaf ada sedikit gangguan dengan penerjemahan. Nanti mohon untuk mencari terjemahan bahasa Indonesia di channel Japanese. Mohon maaf atas gangguannya. Sekali lagi nanti terjemahan bahasa Indonesia akan disediakan di channel Japanese. Mohon maaf atas ketidaknyamannya.
¿Puedo?
Espera un segundito, por favor.
Me avisa.
Who's the second Thai interpreter? It's Basido, right?
Yes, you can assign Pasida.
Okay, I'm starting it now. Okay, is everyone assigned? Are you all in your booths?
Right, I think, are we set? Are we set with the languages?
Okay, if someone has a problem with the interpretation, if some of the interpreters is not assigned, please say it on the chat and we will troubleshoot while the meeting goes on.
Thanks a lot. Thank you. And now we can go back to our channels. Go to the globe icon at the bottom and please select your languages. And Sister Gloria, apologies for that. And if you could go back and repeat a little bit more. So we'd really like to hear you.
Compañera Gloria, disculpe, vamos a utilizar nuevamente la
Colleague
interpretación.
Gloria, we are using interpretation again.
Colocar en el globo de la
Can you
interpretación en
choose
español.
the interpretation by clicking on the globe? Yes,
Está
I'm in
indicando
Spanish.
la
I'm
compañera
indicating
podrías,
also the colleague, I don't know if
no hubo interpretación
you
en
could say what you were saying because there was no interpretation then, so maybe you could repeat a little what you were saying. Okay, I would like to tell you that our organization has been affected dramatically because of the pandemic. We have several lost people. We have not been able to help our colleagues in our regions. We got the disease and we were afraid because of being discriminated because of the disease. Many people are afraid of getting the disease and instead of helping us, they isolated us. This has been critical.
Kutusaidia waliweza kututenganisha.
Can I continue?
Naweza kuendelea?
Sí, Gloria.
Okay. Currently, our situation is becoming worse, especially now because we don't have where to sell our products. And what's worse, if we want to produce the goods or the raw material is very expensive because of the exchange rate with the dollar. Everything, all the materials have a high cost. We would like to propose and we would like to demand for us to be able to work, for them to let us work. We don't want money subsidies because we don't get them. We don't want food baskets because this is not what we need. What we demand is that the government has different modules in the markets or some areas within the markets so we can promote and sell our products. That is what we are demanding. Maybe some bank loans because we have used up our capitals, at least some cheap loans. Right now, we don't have any access to credit. We don't have opportunities, and we are not able to dialogue with the authorities. We presented documents without any response. We knock on the doors, but we do not have any response or answer. And I would like to thank our unity, our solidarity, our colleagues, HomeNet International, for their support in this emergency situation. I also would like to thank the solidarity of some of the colleagues of the markets because they gave us some food in order to be here, to have a dining or a soup kitchen to survive and to go overcome the crisis. The pandemic is very serious in Peru. That's all I wanted to say. Thank you.
Thank you, Sister Gloria, for sharing your experience. And it is indeed a very, very unfortunate time. And, you know, the time when it's not just about work, losing your family members, colleagues. It's been a very tough and testing time for all the home-based workers across the world. And thank you for sharing your experience from Peru and also putting forth the demands. So thanks a lot, Sister Gloria. I know personally you've lost family members. So thanks a lot for coming forth, even despite all of that, and talking to us and talking about solidarity and building it across the world. Thanks a lot, Sister Gloria. Now I'd like to shift to another region, the region of Africa. And I'd like to invite Sister Debbie Damurila. She is the member of Afri Youth Support in Uganda, and she will share her experience now. Sister Debbie, are you there?
Yes, I'm here. Good afternoon, everyone. It's afternoon in Africa, in Uganda, particularly. And I'll be ready in a second. Yeah. We are responding to the COVID effects to the work and the lives of home-based workers and demand of home-based workers for recovery from the effect of COVID-19. Hold on a second. Okay, let's go. Today is the 30th of April. Here in Uganda, it's Labor Day, and it will be tomorrow anyway. So I don't know what the time difference is, but we are happy that everyone has secured some time for a gathering like this one. Home-based workers in Uganda, affiliate groups include Afri Youth Support Group, Patient Space Initiative, and the list is a bit long. I hope you'll share it to save time. It's in one of the slides there. Then the non-affiliate groups, we have the Nubian Consultants, Galima HIV Initiative. It's also another list, hope it will be shared. And the list still continues. But anyway, to wind it up, all views below and from the home-based workers group all across Uganda. We try to represent everyone. We try to be collective, including the whole of Uganda. My next slide is the effect of COVID-19 to the work of the home-based workers. The things that we've greatly suffered is projects are disrupted, and they are still being disrupted because of our economy. The materials that we use locally are getting expensive. Raw materials are really expensive now. Customers are limited to buy the ready products at a higher price if we want to increase the prices. Absence of continuous orders. Orders have been cut short greatly. And then the international market has phased us out a little bit. We do not have, they've cut short of orders. Then there also the fear of venturing. We are all in a pandemic fever. We are fearing to venture into a new incoming generating activity. And I hope to go to the next one, just a second. Computer is a bit slow. Okay, sorry. Continuation of the work. Restriction due to the standard operation procedures. The SOPs restrict us a lot from some gatherings, from the market lives we used to have. And then the local market is very insufficient to sustain us. And then we have a new dimension of life that is internet. Our pricing of Africa, Uganda in particular, is a little bit high. We have a lot of levied taxes on internet and data. It becomes a problem for everyone to be in touch. Then we have the effect of COVID-19 to the lives of the home-based workers. To give our background, we are a little bit near a center, but we'll be okay. Our lives have been greatly affected. We have suffered failures to raise tuition, school fees, which retard education. For the whole 16 months, our children have been out of school due to lockdown. So we have a very backwardness into education. Families have really broken down. They've really broken up because of stress. Life took a turning on us. Things that we didn't know how to handle are happening. Women have really drawn back into the dependency bracket. If you knew you could afford some things, now you can't, you have to ask. And then in Africa, in Uganda particularly, we have a way of closure when we lose people. But it has been a dramatic and traumatic moment when you have to lose someone. The barrier is dramatic, is so hectic. We don't get, we've got limited observation of our cultures, the normal way. So it takes long, people take long while grieving. Then it has also brought about a divide and rule. We are so divided and rule, that phase of life, a divide and rule. As our struggle has been into togetherness, now we can no longer have that togetherness. So everyone has gone back into their corners of lives. And internet is a bit slow where we are, but we're getting there. And then this affects us as ladies and women in home-based workers. More additional burdens have shifted to women and children since everyone has been home. And then we've also suffered a high rate of domestic violence, high crime due to idleness of teenagers especially, high pregnancy rate for children, girls, and high school dropouts. They have really increased because within 16 months, you find your teenager diverting from the education line. In the document, as we will be presenting, we have statistics of crime rates, records for the year 2020. The list is quite long for the 5 minutes I have. I hope everyone will be sharing it later. We've got domestic violence, defilement, theft, we've got child-related offenses, we've got assault, we've got political and media offenses, we've got criminal trespasses, malicious damage of properties, nicotine, and robbery, human trafficking. The list is a bit high, but hope it will be shared around. And my next slide. It is about the positive effects of COVID-19. Surely we cannot be one-sided. People have sat back to improve on the quality of products because you review whatever you've been doing since you have time now. And then there's diverse new skills. People have gone a little bit diverse in creating liquid soap, shampoo making, and looking also for the market on the local ground. We have advanced technology in making briquettes, the one we use for cooking. I hope everyone is aware of them. Our women started up new projects such as fish farming. We've also given a report on that. Businesses have left the analog cluster to go digital, though it's a little bit hard to handle, but there's an improvement. And then we kind of realized the demands for recovery from the effects of COVID-19 as Uganda. We are fighting to denounce criminalities because it's on the rise. We are creating an emergency. We need to create an emergency COVID basic home fund. We need more training in quality control and improving value chain. We need training on work diversity. We need for soft loans it has been raised everywhere. Market creation and sustainability has also been an issue from within our all groups. And then a constant to organize training on the use of internet and whatever follows up for people to follow up. And with that, my conclusion to fellow members is to thank you for your time again. And we pray we all fight together to continue this pandemic, to keep the SOPs. May God bless every one of you. We shall overcome one day. Thank you very much for your time.
Thanks a lot, Sister Debbie. That was excellent. And you've covered so many points. I love the fact where you said we've all moved into our corners. We really have. But you know, these are some of the spaces that brings us back from our corners together, and we definitely shall overcome. You've raised a lot of points, and we are taking note of everything that you said, and we will circulate your presentation. So thanks a lot, Sister Debbie. Now I'd like to invite Sister Veronica Themba. She's the member and treasurer of Uwake, Tanzania. She's an avid home-based worker with entrepreneurial skills in soap making, batik, peanut butter making, and currently running a retail shop herself. Sister Veronica, I'd like to invite you to speak now. Sister Veronica, are you there? Nice to see you. Yeah, nice to see you. Over to you now.
Because we had this social distance, so it was not easier for everyone to meet or to go to the place where you could take your products. That is one. But also the goods which were already produced and made.
Sorry for Veronica. Sorry, we can hear translation on English channel.
Packed flowers for porridge and the nutritious food, they were destroyed, and some of them were thrown out. And those items which expired, they were also thrown out. They were out of use. But also capital per income decreased because people were now at home. They were not able to work or to go to work, so they could services to their families. So, and this created hunger in some of the families, and even some of them took one meal instead of 3 per day. But also price of the items, especially the foodstuffs, the price were very high and they were not available all the time. So that also was affecting the home-based workers and the people in general. But also personal serving, it was impossible because now people were not able to go and work and get money. So serving was not there for the whole period when we were facing the COVID-19. But also some families lost their important people who were providing the basic needs in the families. So it was difficult for them to go with the normal life which they had, since the one who was supporting the life has passed away. So it was difficult for them, and eruption of diseases like stress and high and low blood pressure faced many of home-based workers because they are now idle. They could not know what to do then after, because the disease is still there and we have to live with it. So they had to make sure that they get something to do in order to overcome that. But also some of the families refrained the accepting of extended families because they were not sure of what they are going to feed them. And in Tanzania or Africa in general, you know that we have these extended families. So it was not easy for them to take many people in the family because the assurance of food was not there. But also communication among home-based workers decreased because we had lack of money, so as we could not buy airtime and communicate. So we had this distraction, and the social distance also created a gap between one home-based worker and another. But also the tendency of helping each other, as we said, that when we had an event, or whether it is good or bad, for example, the burial, we had to meet and at least share some ideas and comfort those who are having the problem. But it was not easier. So even our traditional ways of helping each other was difficult due to social distance. But also we had some families were very grateful when we were given some food from Uyego. The amount of money which was given also sustained some of the families, because they also got some food and some items which could sustain their life for that time. Those were the effects of COVID-19. Now the demands, as Tanzanian and a work association, one of the demand that the workers are in need of is education. About the education should be given to home-based workers about healthcare and safety on their daily basis activities, because we have to go on with our activities, though the disease is there, but we should get education on how to take care of ourselves, and also to have some items which will prevent us as we are doing our work, because we cannot stay at home, or we cannot stop doing, because we need social services and basic needs also. But also provision of health service equipment in order to prevent ourselves when we are doing our work. But also home-based workers ran bankrupt because they had nothing to renew their capitals after the COVID-19. So we are trying to support each other, but still the capitals are very low. But also the COVID-19 seems to be a continuous pandemic disease. So if possible, some few members can be given education and to educate or teach others in a group or association on how to protect themselves and how to combat the COVID-19, because we have to live with it in our societies, but we should know on how to go on with. But also to have sessions of guidance and counseling, because some of the members were affected because their important person were flushed away with the COVID, but also some of them are having stress and this high blood pressure. So counseling and guidance should be give any sessions in our group so as to let everyone be in a normal situation. Now, all those are some of the effects and the demands for the home-based workers in Tanzania in general, particularly in the Uwake Association. Thank you very much. I love you all.
Thanks a lot, Sister Veronica. Thanks a lot for the presentation. And, you know, we've heard one after the other how people are unable to work. They want to work, they're unable to work. And like Sister Veronica mentioned, it is a disease, recurring, you know, wave after wave. People say second wave, third wave, it just keeps coming back and it's not been easy for anybody. So just to mention here is I was facilitating this session on behalf of Manali Shah, who is the working committee member from South Asia. And unfortunately, her family members are down with COVID-19 and she's attending to them. And so I had to facilitate on her behalf. So now I'd like to hand over to Sister Lourdes, who will facilitate the rest of the session and invite workers from South Asia and Southeast Asia. Over to you, Sister Lourdes.
Thank you, Janavi Ben. And good morning, good afternoon, and good evening to all of us. And welcome to our sisters, brothers, organizations, and home-based workers, our allies and supporters. So let me take forward this very interesting session. So I would like to invite our sister Apasara Dongal from Sabah in Nepal. She is a home-based worker and also the board member of Sabah, Nepal. She is also blessed with great management skills and manages a common facilitation center where home-based workers and collective procure work. Welcome, Sister Apasara. Are you there? The floor is yours.
Namaste, ma Apsara
Dongol. I am a home-based worker, Apsara Dongol, the board member of Sabah Dongol, and I'm also the account coordinator. On the occasion of International Workers' Day, HomeNet International has organized this webinar, and in this program, I am very happy to share on 1 year's COVID pandemic, what sort of problem we have faced that I'm going to share in front of you all. So regular job orders were totally stopped, and the product that we produce have been piled up in our godown. And some of the products has been already lost, and workers has produced a lot of money, but they are not able to claim the money of their products. And many people who are working in a daily wages are not able to manage even basic meals. And home-based workers, in one way, they are losing their daily income. On the other hand, they have to struggle with their daily living. As a result, they have to face a lot of mental stress. And on behalf of Sabah Nepal speaking, Sabah Nepal has run various cafes and other places are stopped for a long time. As a result, we are facing several challenges to regular operate those enterprises. As a result, thousands of home-based workers are jobless. In this situation, the way in 2015, earthquake hardly hit it in Nepal, and many people were facing several challenges, and HomeNet International in South Asia was supporting for this initiative, and as a result, many workers were felt great relief with the HomeNet support. And through their support, like they have provided free meal for 3,000 people in a day. As a result, though the people were, losing their house, but at least they were having their food during the earthquake disaster in 2015. But now, because of the COVID pandemic, people are even not getting their basic food. Government is not giving any relief items. So our ultimate hope is the home-based workers and their affiliates and their organizations, and also their network organization, because we can't rely on the government support. So the global pandemic that COVID has brought up in this situation, so the daily challenges that the home-based workers are facing, we workers who are working in the home-based sector globally, we need to unite and put our solidarity so that the food items, the support on the food item, and also provide the market facility for the product and market facilitation, and also assuring new jobs, so that the thousands of hundreds of thousands of people who are working in a home-based as a home-based workers can be benefited. And what Sabha Nepal is working should be further continued, and also the provision of emergency fund, provision of the soft loan, provision of the capital fund is very much important. And these are our key demands that we are putting towards the Nepal government. And the social security scheme that the government of Nepal is initiated is not covered to the informal sector and unorganized sector. And we would like to demand these to be covered under the social security scheme. So especially like the medical support, ventilators, and other type of support should be accessed by the home-based worker. With this, I'd like to end. Thank you.
Thank you, Sister Pasara. We have just heard what are the challenges having faced by our home-based workers in Nepal, and I think almost all of us are having same experiences with regards on the effect of this pandemic. Again, thank you, Pasara. And now I would like to invite Sister Shabnam Sheikh. Shabnam Ben is a garment worker in the city of Ahmedabad, India. She has been a member of Sewa Union for the last 20 years and represents home-based workers in the executive committee. So, Sister Shabnam Ben, are you there?
Namaskar. Hello. Hello. Namaskar. Greetings. I'm Shabnam Sheikh, and I am a home-based worker. And I would like to represent and talk about the home-based workers. They are facing many challenges, and they're facing so many issues. The main thing is this, that I was taking credit during this COVID at 20 rupees, 50 rupees, and there was problem in children's education also, because in a house there are at least 3 children, and we are all home-based workers. We don't have a permanent source of income or mobile, so that we can continue with the online education. It was a big problem, and there were so many problems in our life. Then we taught women how to stitch masks, and they were doing well. Earlier, the problems were different, but now in this new wave, the problems have aggravated like anything. And now there are so many problems we are encountering, that there is no work for the home-based workers. We don't have capital, we don't have savings. We are not able to educate our children. Children can't get educated. And in this pandemic, You know, we don't have money for taking anyone to hospital. And we are still taking loans to survive. And now we are not even getting food to eat, and hospitalization. Then we are not having money at all. There's so much of dearth of money. We don't have, and then again, no education. They don't have money. They are facing scores of issues. It's a very dismal situation. And I don't know how we are going to manage this situation in one house, in one household. Everyone is having cough, cold, fever, so many ailments. Then the government is not giving any medical aid. So we don't go to government hospital. They say that if we go to the government hospital, then we will not be able to come from that hospital. And private hospitals are very expensive. They cannot afford it. So that is another problem. So when they get infected, we have to take them to the hospital, and for that they have to take loan. They take loans and they go for treatment with that money. Now I would like to talk about my own family, or my members. So many people are infected in the household also. There are so many problems we are encountering at home. We don't know how to come out of this situation. Now about vaccines, the sisters say that if we take vaccine, we will die. We just don't want to go for vaccine because if they get corona, they try to hide it because they take it as a social stigma. They will get isolated the moment people know they will not be able to earn 2 meals a day. So that's why they try to keep it under carpet. So this is the apprehension that when they get corona, they just don't tell people, and they just don't want to go to the government hospital. They say that if they go to the government hospital, they will die. They will never come back home. So the sisters are so scared. They're so frightened, and they are saying that we don't want to take vaccine. I have tried to convince them that I have taken vaccine, but see, I have not died. Nobody dies if you are inoculated. Nothing happens, and it is a protection gear, and it will be good for you. This is how I explain to them. And our sisters are stitching masks nowadays, and they are continuing with this work. But what I would like to state is that we are facing so many problems, the people who are home-based workers, but we have no assistance, no support. This is such a big pandemic. It is so colossal, but the government is not giving us any aid. I would like to state that for our home-based workers, especially women, they should get beds in government hospital. They should, their vaccine should be free. They should get free masks, gloves, and they at the same time they should be there should be some data for them, like in the government schemes or the government security schemes. There should be a data for them so that we know these people are also visualized that certain amount has been given in their account. So for home-based workers, there should be a data. It is very significant. It should be done. Like from 5,000 to 7,000 rupees they should get in their account. And they should get a ration for 6 months free of cost. These are big problems. Now children are not getting educated. It is so such a big issue for them because they don't have a mobile phone. So how will they get educated? This is a big problem.
So, Sister Shabnam,
Sister Shabnam, we can't hear you.
we can't hear you. If you are speaking, we cannot hear your voice. Yes.
Hello.
Hello. Hello.
Hello. Can you hear me? Can you hear me now? Am I
Yes.
audible?
Yes, loud and clear.
Yes, you are
Okay, you
loud
can
and clear
continue.
now.
Yeah,
You can
you can
complete.
continue.
You can continue. That I would like to state that they should be prepared and they should be prepared for any kind of eventuality that comes in their life in future also. This is what I would like to say. And for the employment of these women, preparation should be made. And whatever I told you, that they should be given some amount like 5,000 to 7,000 in their account. Their children should be educated. And it is a very important issue. This is my demand. And this is what I would like to project before you. Thank you.
Okay, thank you, Sister Shabnam. My heart is already aching for what I'm hearing from our speakers. We really need to be united in order to have one voice and seek for government support and ask for concrete programs and services for home-based workers and workers in the informal economy in general. So now let us shift our focus on the region where I came from, Southeast Asia. I would like to invite Sister Arya. She is the area coordinator for HomeNet Indonesia for Banten province. She has been working as a home-based worker for the last 24 years and her expertise lies in embroidery. Sister Arya, I would like to welcome you to share your experience. The floor is yours.
Hello. Hello. I would like to share with you about our experience in this pandemic, this COVID-19 pandemic that has affected the lives of home-based workers in Indonesia. Many were terminated. Many were terminated from their work. Many of us lost our jobs. We lost orders. We had much fewer orders. We hope that during this pandemic, we hope that the pandemic will soon end so that everything can go back to normal. Even though the pandemic isn't truly over yet, we hope that we can still get orders for our products. We can run our business so that we can still get income. Thank you very much.
Thank you, Sister Arya. And now we are coming to the end of this session, and I would like to invite Brother Manuk Keupaka. Manuk is the president of HomeNet Thailand. He was laid off from a garment factory in the early 20s and posed that he and 30 other workers got together to open their own workshop to produce for both domestic as well as global supply chains. Brother Manuk, I would like to hand over the space to you.
Hello. The situation for COVID-19. Hold on one moment. พี่เหมียวพูดได้ไหมคะพอดีเปลี่ยนเครื่องไม่ทัน
Currently, the government
มานพ
cannot control the
แม่
situation of
แป๊บหนึ่ง
the
ได้ไหมแปลเขายัง
pandemic
ไม่ค่อยเรียบร้อย
พี่มานพอยู่พี่มานพเสียงจริงอยู่ในไหนอะคะ
โอเคได้แล้วค่ะ For home-based workers in
the
Thailand
situation
after
of
the third wave of the pandemic
Thai,
is very intense
home-based worker actually
nowadays
like
because
suffer
the
from
number of
pandemic.
fatalities
The
and
number
the
of
infected
the
case
infected
is
person
increasing,
increase
and
every day,
the
and the
government is not
cannot
able to control it. We don't have
enact or
any
use any measure
remedial
to
measures,
provide relief
and
package.
so
The
the
services
assistance
for
from the
home-based
government
workers
is
have been
delayed, and
delayed
the
and
struggle
delivered
for
in untimely
home-based
manner.
workers
Many
is
home-based workers
persisting, and we
cannot
don't have
actually like
income,
wait for
and
the
home-based
government
workers
support and
are mostly
intervention.
the
Many
poor,
of them
and
are
we
urban
have
poor,
a
and they
lot
have
of
a lot of
responsibility to have to
responsibility
care
in
for
the family.
elderly,
For example, taking
disabled
care
people
of
and
people with
children,
disability, the elderly
and
or
our
children.
savings
They
are
don't
gone
have
from the
saving
first and the
because the
second wave
saving
already,
has been
and
spent in the first and the
the
second
market
wave.
to which
The
we sell
market
our
and
goods
the
has closed down
distribution outlet
because the
has been
government has
closed
tried
because
to
of the
control
government's
the movements
controls of the
of the
traveling or
people
the
and restrict
semi
the movement of
lockdown.
people.
People
So people
were
also fear
terrified of going
to go
outside or
outside,
like shopping,
and
so
so
that
we have
reduce our
Excuse
any
income
me,
less.
the
tremendously.
translation is not so clear. There is a echo
Hello, can
behind.
you hear me?
Yes.
Hello.
Hello,
That's
is it
clear.
good now?
Okay, it's
Okay.
now clear. Thank you. Okay, you can continue, Manu.
Okay, and the
Sorry.
people cannot actually like access the market because of the
And
seller cannot
we
the
cannot
buyer
produce
cannot
anything
order product
because
from
the
us
sellers
because they don't
and the
have
vendors
any
cannot sell anything as well.
any
And the
customer.
demands we
We
have
made the demand to
for
the
the government
government
is that
regarding
we
the
want the
Home-Based Worker
law to
Protection
protect
Act.
the
We
home-based
have
workers.
made
We
demand to
demanded
น้อง
that
น้องคะทำไม
government.
มันมีเสียงแปลสองคนออกมา
Are
ทาง
you
ช่องแปล
using?
ภาษาอังกฤษน่ะ
Yeah,
I
maybe.
try to tell
Yes,
the
maybe the mic.
Thai interpreter that
Yes.
we can hear two persons
Yes.
translate at the same time.
Yes.
Can we just ask one English interpreter to speak and not two of them? We are hearing two voices. Please, Manu, sorry to disturb you.
Sorry for the disturbance,
แป๊บ
Manu.
แป๊บหนึ่งนะ
Okay.
จ๊ะมานพโทษด้วยไอ้แปลมันเสียงมันซ้อนกันสองคนนะจ๊ะ
Okay, ได้ยินเราไหมคะ Oh, can we all hear now? Okay,
Yes.
so yeah, are we speaking? I'm sorry.
Okay, Manu, you can continue. Sorry. Brother Manok, I'm sorry to
มานพ
interrupt you
อีก
again
อีก
because
แล้วจ้ะเพ
we
ราะว่าตอน
cannot
นี้ไม่มีเสียง
hear
แปลเล
the
ย
English translation.
มันเกิดอะไร
Sorry.
ขึ้นน่ะ
Yes, sorry about that. Hello, can you hear me now? Yeah, is it good now? Can you hear now?
Yes, we can.
มานพสงสัยมานพต้อง
โอเค
เริ่มใหม่อ่ะจ้ะแต่พูดช้าแล้วก็สั้นลงนิดก็ได้ เพราะว่าที่ผ่านมานี่ถือว่าใช้ไม่ได้เลย มันไม่ได้ มีช่วงหนึ่งแปลเป็นสองคนแล้วก็ถึงตอนนี้ไม่มีเสียงแปลเลย อาจจะต้องขอให้
Okay,
มาน
so
พเริ่มใหม่
he's gonna start again. I'm so sorry for this. Okay, can we start now?
มานพจะเริ่มใหม่อีกทีนะ
Yes. Please go ahead and start again. Okay, can I start now?
Yes, you can start, Brother Manu.
เริ่มได้ค่ะพี่มนุ
Sorry for the interruption.
Okay, so the situation in the third wave hurt the home-based worker and make us struggle more. The assistance from the government has not been received by us. And so we struggled a lot more because we don't have work, we don't have income. And home-based workers, as we all know, we are the poor people. We have to care for elderly, the disabled, and the children, and we used up our saving from the first wave. And we cannot sell our products in the markets, and so we cannot produce any goods. And as for the demands to the government, the demands to the government, we demanded the government look into the laws to protect the home-based workers, and also make sure that we can access the funds and give low interest rates or no interest rates, and also make the conditions in more lenient in order to access the fund. And the urgent, I mean, we get the help and assistance from Homeland Thailand. They help supplies necessities to us, for example, alcohol, gel, and masks. We encourage our members to produce goods so that we can sell and distribute to those in need. And we encourage people to plant their own vegetables so that their lives can be more sustainable, relying on their foods. And what we can do is that we believe that our strong network can help each other and share things among each other and overcome this pandemic together. I want to send my regards to all those who are suffering the pandemic together with us. Thank you so much.
Thank you, Brother Manup. And again, sorry for the many interruptions. And again, we heard the issue of the supply and demands regarding the needs of home-based workers and other workers in the informal economy. Janavid, do we have still time for the presentation? Sorry for the confusion. Actually, HomeNet Philippines and Patamaba write a collective report regarding our topic. So if the body may allow me for another 5 minutes, I'll try to summarize our report. Can I?
So we're running out of time, Lourdes, but yeah, you could briefly present that. Thank you.
Okay, thank you. So with regards on how COVID is affecting the work and lives of home-based workers, just like what the other speakers report, we are also suffering same situation here in the Philippines, and the pandemic does not pick who or where to victimize. Everyone suffered work stoppage because of the total or partial lockdown, like the ACQ, GCQ, MGCQ, and the economic or livelihood activities of informal workers was stopped and lost their income, struggling to augment to meet the basic needs of the family, especially on food, health, education, utility payment, and other bills. And most formal workers lost their jobs and started to open their enterprises via online selling. So this further increases the number of informal workers. So daily food consumption, instead of eating 3 times a day, we only eat once or twice a day now. So the lack of no means of medication. Stress to parents with children, online modular learning that needs to purchase gadgets, fast internet connection, Xerox copy of materials, and mentoring their children, just what we have heard also to other speakers. On mental health, because of stress and cases of gender-based violence, human trafficking, voyeurism, and pornography are also the case, and worries and fear of being contaminated and discrimination against confirmed and suspected COVID patients. So what are the demands of home-based workers? So First and foremost is the passage of MACWI, the Magna Carta of Workers in the Informal Economy Bill, into law, because during this time of pandemic, home-based workers and other workers in the informal economy suffers even more. So this is the only law, if it should pass. It's almost half a decade now. We are lobbying for this bill to be passed. Also, access to social protection, especially on the universal health care, where the Philippine government has just passed this universal health care, and also social security, access to financing, and capacity and capability building, and of course the crucial role of the organization, especially on organizing and strengthening the network of home-based workers, the membership-based organizations, and the cooperatives for resiliency building, and to ensure representation in different bodies. Also ensure effective implementation by including informal worker representatives to the Informal Confederation, Informal Workers Confederation, the academe, and the civil society organization. So that's all, and thank you to all the sisters and brothers for sharing your experiences. And the times are very tough, and I'm glad that we could come together and share our experience and put forth our demands. So for now, I would hand over to Brother Edwin to facilitate the next session. Thank you very much for listening. Brother Edwin, it's the floor is yours. Thank you.
Okay, thanks, Lourdes. My name is Edwin Bett, an HNI working committee member at Omnet International, and the support for the African Regional Platform. Thanks everyone who's been able to share. We didn't have enough space to be able to accommodate all of us. So we had provided for 2 representatives from every region. So we've had 8 speakers speak. But the opportunity that we have now is to listen from other workers. Could be those of us who are affiliates, the non-affiliates, or the observers. We also have other sectors who would be present today. Those of us who are street vendors, waste pickers, or domestic workers, as well as any other observer or a guest who was able to join us this evening. We would like to hear from you. Please do share your experiences, how COVID as a pandemic has become an impediment to your life, and what are the demands that we are all currently facing. You could also comment on what the 8 speakers have mentioned, as well as clarify if the presentation came from your region and maybe one thing was missed. So welcome everyone, or those of us who are able to speak. We have about 20 minutes or 15 to listen to other workers who haven't been able to talk.
Hello. Hello.
Yes.
I'm Sian from Cambodia. Can I just add a few points from what I observed from the speakers?
Yes, please go on.
Yeah. I hear a lot from all the 8 speakers from different regions, and as Lodi said, we have similar problem. But I would like to add, in the developing country like Cambodia, even worse, because our group also not as striking with getting out of home to make money, to get out for food, even more expensive, and lead to the stress and depression. So even worse, because they borrow money from micro finance or bank, so they are facing with the shortage of food to eat, but even worse when they don't have money to pay back to the bank or microfinance. And secondly, I hear a lot about all speaker. They talk about marketing, making products, and this is, I think, about livelihood. So I don't know whether Homenet International will think about livelihood program, because many speakers were saying that we don't need to just rely on the government in terms of support, social assistance and social security, so we need to find way to get enough money through for their daily living, so something like that. I don't know. I just ask whether Homenet National should think about livelihood program apart from social protection, because livelihood can make our home-based worker survive from day to day, or even when they gain more money, they have more time to think about social protection and advocacy for social protection, something like that. Thank you.
Thank you, Sinon from Cambodia. The working committee at Omnet International are looking at all these demands. There are those which can be prioritized and some work done on them. Some need to be moved to advocacy and then see how best to work with it at the country level or at the ILO level. But that would take a while. But I want to agree with you that the lives of home-based workers are almost entirely dependent on the livelihoods that are very precarious, and they are like day-to-day activities. And we all need to work jointly to see how best to make it a reality for each home-based worker to earn an income. Thanks so much for that. We are going to listen to, we have two individuals who would want to speak. We have an individual from Tabaka Unduku Suppliers in Kisi. You'll go first. Then we have Jackson from Atemdo from Brazil. You'll speak second as we wait for anybody else who will put up their hand. So Aaron, welcome.
Hello. 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 Hello.
Yes, Hassan.
My name is Hassan. I'm from Undugu, Tabaka. I'd like to say my experience with the COVID-19. In Undugu, we deal with handcrafts, and the orders have really deteriorated, and the income for home-based workers has come down because we cannot access the orders we used to access, and the income is down. Another problem that we experience, the education system in this area program has been changed. The children from this area cannot easily access education because of the COVID-19. Lockdown have really affected us because one individual or a husband may be working from a different county, and when the lockdown was put, the family relationship have kind of been affected because I'm from the urban area she is working to go to the wife, and that has affected the relationship. We have domestic violence in this area because of the COVID-19, because when the income has come down, there are individual or quarrels at homes because of that. Another problem we experience
I think, did we lose you, Hassan?
Edwin, I think he got dropped off the call, and maybe we can come back to him.
Yeah, okay, thank you. Then as we wait for tobacco suppliers to come back, then we could listen to, we have two people from Atemdo, that is Jackson and Edna. Whom would you like to speak first? Jackson or Edna, one of you, please. Jackson or Edna from and you're on mute. Yes.
Good morning, good afternoon, good evening to everybody. I would like to thank HomeNet for this lovely perspective or this lovely hug you're giving us. We are really suffering a lot, and this suffering is present in all parts of the world, and our suffering increases and people are excluded. We are being badly treated, even worse than we had been treated before the pandemic. And we are looking at the different governments that are denying to accept the fact that this pandemic is killing poor people in our country, especially Black people, and those people that are more vulnerable. And that makes us sad. There are people who are feeling depressed because we look at everywhere in the world and we cannot find a solution to our problem. We are trying to make this suffering a little bit less present with the support from other people or uniting with other organizations so as to support each other, even though it's a support that has to do with feelings or an emotional support. We need to support each other so that people are not depressed. And you have already said that this is something that is becoming even worse in Brazil. We are still getting ready for a third wave. We had two other waves before, and we have now different stems in the country, and the government is denying everything. We are seeing that the citizens are becoming poorer and we are suffering a lot, whether it is in the street or in the hospitals, and we cannot go out to work. It is really difficult for us. We are in pain. And we are still facing lots of difficulties, but I believe that with this unity and this strength that we are developing, I believe that we are going to at least minimize our suffering. So I would like to give all my love to all the people, especially in India, who are really undergoing a very serious stage of the pandemic. The pandemic is killing lots of people there. It's difficult to look at the news that come from that country, and it's a country which has already been punished by other matters and now because of the pandemic. So I would like to give my love to all the people here, and I would like to undergo this hurricane with the less suffering possible. So I would like to thank you all. We're together and we're going to fight together. Thank you.
Thank you, Jackson, for sharing and also for pouring out your love for the brothers and sisters in India. We could now turn to and listen to Dabil Lamine. Please, if you are hearing us, go ahead and you're on mute. Please unmute and then speak. Unmute your microphone, Dabil. You are on mute. Yes, go on.
And it has to stop because of the pandemic. So we were in lockdown, so we had to spend about plus minus 6 months without any work, and we were at home. It was closed. So lucky for us, the government, like the social services, didn't cancel the contract. So when we were done with like 11-1 now, as we are, so we started again with the contract that was on hold when the lockdown was on. So we did lose because of the time. That was our loss. But lucky for us, we had to start again and then continue in the same thing, like the contract was on. So we are on, like now we're still busy with the school uniform from social development. That was our loss. It was only time, but we are still on now doing the school uniform. We thank you.
Thanks a lot, Dabil Lamine. I do not see anyone else who's put up their hand, and thanks for sharing and giving hope that even where work gets stopped, you've been able to begin afresh and start generating some income from the sewing.
Yeah. Who are still on work. They are still here and they are working. You can see them. So we're still on. Thank you. Thank you so much.
Thank you, Lord.
Ciao.
So thanks a lot. We are short of the 20 minutes we had to speak. If we have anyone else who still has a comment, clarification, or a share to do, please do so on chat. But I would like to take this back to Janvi. Welcome.
Thanks a lot. Thanks a lot, Edwin. And thank you to all the home-based workers who shared your experiences. You know, we were taking notes while the session was on, and I'm going to go back. Unfortunately, I think the link isn't working as yet. So we are going to work on that and send it to everybody. So this is what we when all the and it is extremely difficult to put it all together in just this session. You know, the experiences are similar, but also very diverse. You know, we all know the political situation is different. The impact in many ways is also different. Wait somewhere. So, sorry, I think I'd have to request people to mute. So we've put all of this, and what we're going to do is send it to all our affiliates and participants on this group, and feel free to add to it. I'm just going to try and summarize a little bit that, you know, there are different pockets in which we can put some of the experiences and the impact that you've talked about. The first is, you know, lockdowns, unable to go out, and therefore there was no work. There's lack of income, you know, access to raw material, or also the raw materials becoming extremely expensive. Access to markets have been very difficult. And some of you mentioned about products piling up. The other aspect, which a lot of them talked about, was loss of family members and comrades within the organization, and how, you know, all the workers have had to face grief while all of this has been going on. The third is around access to food. Across region, people have talked about lack of food when the pandemic started, and even today in many regions. People also talked about lack of access to healthcare, social security, pensions. They also talked about, you know, depression. It's not just COVID. So it's not just COVID-19, you know, it is mental illness, it's depression, it's hypertension, it's stress, everything's adding up together. There's also talk about, you know, lack of capital to work with, savings being wiped out, loans, not only difficult to access, but very difficult, high interest loans. People touched upon care work, how it's becoming very difficult, you know, access to digital devices, internet, how it's been very difficult even to organize workers because of all of this, and education for children. And many talked about increase in domestic violence. So I'm going to share this, and you know, I'm sure that workers may want to add to it. I'm, you know, also was structuring a lot of demands that came across from different regions. You know, one entire piece was around the fact that home-based workers want to be heard, want to be seen, they want to be included in you know, the government schemes that are being made, cash transfers that are being made. People are looking for laws for home-based workers and inclusion in decision-making processes. Everybody's talked about access to work, access to income. They've talked about, you know, we want to work someplace, sell our products and credit. I'm reading out: home-based workers unite for access to markets and assurance of new forms of work. What is working right now? There's also, you know, they talked about strong network and supporting each other in overcoming this pandemic. The second piece, and a very big piece, was around, you know, advocacy around social protection. From Southeast Asia, brother talked about how HNI also needs to step into this role and you know, advocate for social protection for home-based workers. People talked about access to PPEs and health supplies, beds in government hospitals, access to vaccines, counseling sessions. You know, mental health is very important, and we figured out at this point of time. Somebody even talked about creating data of home-based workers and cash transfers for them. Somebody mentioned about access to medical facility, specifically ventilators and vaccines, basic income and social security schemes specifically for home-based workers. Members also talked about emergency fund for during the time of pandemic, no interest loan, easily accessible loans, provision of capital and emergency funds. And last but not the least, a big chunk around training to use internet, access to digital devices, access to data packs, and education around how to use it. So I'm going to pause here and just ask maybe 1 or 2 minutes on this. If I've missed out on something which was a non-negotiable and something you want to add. I'm going to stop sharing. Suntari, please, do you want to add? Sorry, I think the link, you don't have access to it right now. I did put in the link. However, we will send it on an email for everybody to access and add. Suntari, did you want to add something? All right. I can see this. I can see one person raising the hand. Please go ahead. Yeah, I think a brother got dropped out last time. Please go ahead.
Yeah, my name is Hassan. As I was continuing, the pandemic has affected us very much. We don't have anything to do. We are just waiting, resting. We don't have access to finance. We just request maybe there is with the solidarity of home-based workers, we can be able to get assistance to access the orders and also be able to get something to get food, to access food for our families in Tabaka, in Kisii of Kenya. Another thing which I wanted to say was with the restrictions in place, the lockdowns, we are unable to sell even the agricultural produce we put. We are unable to sell them to other people. So the food security is also affected by such a lockdowns. We will request maybe the government to lessen such a lockdown so that we can able to sell this and maybe gain some income for our families.
Thank you. Thank you. So please have your hand raised.
Yes. Thank you, Genvi. The things that I would like to share, my idea, my point now is, even now we face the very hard time of pandemic, and many recommendation or many demand is about to to pass this hardening time, but at the same time, I think we need to thinking of the long run strategy and long run policies of the government as well. So we will not stop only to get some immediate measure, but it's a time that we will call for the more secure policy, like a long term of social protection, universal health coverage. I think we ought to do, my idea is we ought to do two things together. First is the immediately measure that we have to call for help us pass this hard time, but at the same time we have to plan for advocate or the demand for the more long-term and more secure policies and measures.
Thank you, Suntri. A very important point. We focus on short-term, immediate demands and long-term on universal health coverage. I'll take one last input from Edna. Edna from Brazil. I think if you could provide your input, and then we'll have to wrap up. Edna, are you there? Edna from Atendo.
Oi, bom dia. Tô sim. Estão conseguindo me ouvir? Ah, bacana, gente. Obrigada, né, por terem.
I want to make a quick comment. I am Edna. I am president here of the organization in Brazil. And after listening to all the comments, I feel that our pain, our demands are the same. So what we see, what we have heard, what you mentioned about what's going on in your countries, it's what's going on in our country, that it's what's going on in Brazil as well. So we believe that our pain is the same, our demands are the same, and the goal of home-based workers is the same all over the world. We need our rights to be guaranteed. Today, I was thinking about all these that you have mentioned. What can we do? What can we think collectively as HomeNet so that we can help at this time of emergency to help our workers? What each country is doing right now to contribute, to help, what can be used as an example by the other countries, by the other workers' organizations. I'm going to provide an example. Here, for example, I believe this is going on in different parts of the world. Here, we are gathering food to help our workers, and we are helping everyone, not only our workers, we help all the neighbors, everyone we know, so that are going through the same situation. And what we have thought is that we see there's a great difficulty. We need to improve the production of our workers. So we organized store collectively, and we have worked by promoting the production of these workers in the internet. Without this work, they cannot buy raw material. And I believe that, I don't know how that could work as in a big network like HomeNet. We can think about what kind of raw material we could buy collectively so that countries can help each other. Maybe this raw material is easy to find in this country. I don't know. I'm thinking about way of overcoming this situation collectively within a network to help each other. That's all. Thank you. I'm thinking about this because we have a lot of demands. We talk a lot about our needs, and we need to start thinking about how to overcome this. The government has a responsibility, but we need to think that as a network, we can help each other. That's all. Thank you for your attention.
Thanks a lot, Edna. Thanks for that input. You know, the role of collective, what do we do? How do we learn from each other? But also, how do we access raw material together? So a lot of deliberation and something that we need to do as HomeNet International. Thank you, everybody, for your inputs. We will share the link and get your inputs, and we are going to use these demands extensively throughout the month of May, and we are going to put it out. Please go through our website, be a part of our social media pages, and let's amplify our voice together, our demands together, and collectively give our inputs to the working committee on how do we strategize towards these demands. I'm extremely sorry if I have missed out on anybody and taken any inputs, but I will share the sheet. I know I've missed out on a sister from Africa. Will it be possible for you to type in? We are 15 minutes over, and I'd like to hand over to Sister Veronica Lopez. She is the International Working Committee member from Latin America. And I'd like to invite her to provide closing remarks. Over to you, Sister Veronica.
Good morning, colleagues from HomeNet International. For us, can you hear me? Yes, Veronica, we hear you. Thank you. It's a pleasure to greet you all in Latin America and the Caribbean. This is a pleasure. Participating in this webinar is a pleasure. May the 1st is the International Work Day. We would like to greet you all. We would like to thank you all those who connected from different regions, because we know we have different time zones, but we are here. We are together working to build new opportunities, to create new opportunities, to create access to education, to free healthcare. That is a demand that home-based workers have had for many years. And from my region, we would like to tell you that we need to advance on this to fulfill or to guarantee the rights of the workers. We agree on many things after listening to all of you. We have a lot of things in common. So as a region, as an organization, and as a group of sister organizations, the challenge is to build together the ways to move forward. We need to identify the challenges to improve the conditions of home-based workers. We are committed to strengthening the conditions of the home-based workers. We need to break those stereotypes, to erase those stereotypes, because the pandemic has isolated us. But now we are fighting to be part of that working class that is doing its best, that we are always contributing to the economy of our countries. We are isolating us, and that's, we need to have capital, but because capital help us build together, but at the same time, the lack of capital isolates us. So that's why we need to strengthen our organizations. And May the 1st is an important day. We would like to greet all of you from Nicaragua. We are celebrating our solidarity as brothers and sisters. Blessings to all.
Thanks a lot, Sister Veronica. And with that, I would not like to take any more time. And sorry for going a little over, but we wanted to ensure that everybody gets time to speak. And again, apologies for whoever we've missed out on. Feel free to write to us and we'll keep adding. And we are all in this together. And thank you all for taking out time. You know, during the pandemic, it's extremely important. Despite facing grief, loss, everyone's come together to build solidarity. So thank you to each and every one of you. We are in this together, and let's put forth a demand and amplify our voices. Thanks a lot, everybody. Stay safe until we meet again. Thank you, everyone.